Hi, Cindy. Thank you for coming in to chat with me today. I understand you are now 40 weeks and 3 days pregnant and that you have had a low risk pregnancy with no complications to date, which is really fantastic. Now, I know we've spoken previously about what is important to you during this pregnancy, this being a normal vaginal birth and minimal interventions. You also mentioned that it is very important for you to wait until 40 weeks and 10 days before booking an induction, and I know you've written some questions down for me today. So I have your questions here, and it's a great idea to write them down because then you don't forget. So if it's okay, I'll read through them now with you. So Cindy, your first question was, how does an induction actually work? So firstly, when you come into the hospital for your induction, I will check your observations. So your blood pressure, your temperature, heart rate, and the oxygen saturation of your blood. I'll ask you a few questions about your baby's movements and make sure you're feeling okay and still happy to proceed with the induction. After this is all complete, and as long as you are still comfortable, I will need to complete an internal vaginal examination to assess your cervix and see how ready your body is for labour. The examination can be a little uncomfortable and you may feel a bit of pressure. The more you're able to relax and breathe, this will help. I'll proceed nice and slowly, and remember you can ask me to pause or stop anytime you wish. So I will assess your cervix based on what is referred to as a modified Bishop score. This looks at a few different signs that your body is preparing for labour. Things such as how dilated your cervix is, where it's positioned, so your cervix moves to more of an anterior or front position as you prepare for labour. The consistency, is it firm or soft and stretchy, how long your cervix is, and what we call a station, or where the baby's head is positioned in relation to your pelvic bones. Based on all these factors, I will assign a modified Bishop score, which, if it's less than 5, will indicate that there is a need for what we call cervical ripening in preparation for your induction of labour. Once I have assessed your cervix, we'll need to monitor your baby for a little while. This will be done using a continuous monitoring or on a CTG machine, and that will listen to your baby's heartbeat continuously for a short period, maybe about 30 minutes, or until the trace is what we call reassuring and we can see that baby is nice and happy. After the CTG is complete, you'll be given a medication called dinoprostin, which is a synthetic form of the hormone prostaglandin. Prostaglandins help to break down or soften the collagen in your cervix, which facilitates dilation and helps get your body ready for labour. With an induction of labour, we use a synthetic prostaglandin to help your body with this process. This is the cervical ripening I mentioned earlier. Now, there are two different ways dinoprostin can be administered, but we will be using the form of dinoprostin called Cervidil. Cervidil is a pessary that is inserted into your vagina towards the back of your cervix using a water-based lubricant for comfort. The pessary releases a dose of 0.3 milligrams of prostaglandin per hour, and it's commonly prescribed for 12 hours. So we'll administer approximately 4 grams of prostaglandin over that time. Cervidil works as a local hormone to relax the smooth muscles of your cervix while also breaking down the collagen network in your cervix, helping it to soften and dilate. Your baby's heartbeat and your uterine activity will be monitored while the medication is being administered, so you will need to stay in the hospital during this time. Now, if the Cervidil works and your cervix softens as planned, the next step would be to artificially rupture your membranes or break your waters, but we need to wait at least 30 minutes after the removal of the Cervidil to do this. To rupture your membranes, I will do a vaginal examination and then insert a small instrument similar to like a knitting needle with a tiny hook at the end. This will be used to puncture a hole in the membranes and allow the amniotic fluid to drain. The procedure itself is painless, although you may feel some pressure or discomfort during the vaginal examination. Once again, if at any time it's too much, you can ask me to stop. Now, sometimes the Cervidil alone or the combination of Cervidil and the breaking of your waters is enough to start labour, and we don't need to proceed with the next stage of induction. If your body still needs a little help for labour to begin, we can commence the next stage, which is the oxytocin drip. Now, oxytocin is a hormone your body naturally produces to stimulate uterine contractions and progress your labour. However, during an induction, we use a synthetic form of oxytocin known as syntocinon, which is administered via an IV infusion over a period of time to stimulate your contractions and progress your labour. We start the oxytocin at a very low dose, and based on how your body and your baby are coping and how labour is progressing, we can increase the dosage. Once started, the oxytocin will continue to run until the birth of your baby. So, Cindy, the second question you've got here is, how long does an induction of labour take? So, Everybody is different, so it's really hard to estimate how long an induction of labour will take. As Cervidil is a slow-release pessary, it is generally prescribed for a 12-hour dose, although in some cases it can fall out before this time. During this time, while the Cervidil works to ripen your cervix, you may feel a little bit crampy. This is all okay and expected, and we'll monitor you throughout. Once the cervidil is removed or has fallen out, we need to wait at least 30 minutes before we can rupture your membranes and begin the oxytocin infusion process. The oxytocin doesn't have to begin straight away, so we can give you some time if everything is going well, baby's heart rate is reassuring, and you want to wait and see if rupturing your membranes is enough to get things going. Once commenced, the time it takes for the oxytocin infusion to work can vary, but typically it's about 1 to 4 hours for regular contractions to begin. Just like with spontaneous labour, the time it takes for an induction of labour varies, but we roughly expect 1 centimetre of cervical dilation every 1 to 2 hours, and then between 1 to 3 hours for the second and third stage, which is the pushing and delivery of the placenta. The time an induction of labour takes, it really varies from woman to woman, so it's a good idea to try not to focus too much on timing, but more on listening to your body. I'll be there to help guide and support you also. Your third question, Cindy, was if there are any side effects of the dinoprostin and oxytocin medications. So as your cervix begins to change because of the medication, you may feel quite crampy or uncomfortable. This is quite normal and a sign of things are progressing. The most common minor side effects we will look out for are feeling nauseous or vomiting. This normally does pass quite quickly, but if not, and you're feeling really unwell, we can give you some medication, which is called metoclopramide, and that helps manage the symptoms. You'll have a bathroom in your room, which can also be really useful if you have loose bowel movements, which is also quite common. Now, you may feel warm or flushed in your face. We can help with some cool cloths and make sure you sip on water to keep yourself hydrated. You may feel a little dizzy or like your heart is racing. If this happens, please let us know and we can adjust your positioning, which can help. Now, the most common major side effects we see is an overstimulation of your uterus. Some people are really sensitive to dinoprostin and oxytocin, and the medication can make your contractions very strong and close together, making it hard for you and your baby to recover between them. When this happens, it can reduce the amount of blood flow through the placenta, affecting baby's heart rate and oxygen levels in the blood, which can lead to fetal distress. During your induction of labour, we will monitor you closely, and should this occur, there are a few steps we can take to reduce the effects. One of the benefits of using Cervidil as a prostaglandin initially is that it can be quickly and easily removed using the retrieval tape should complications such as overstimulation of your uterus arise. If hyperstimulation is due to the oxytocin drip, what we can do is turn the dosage down to give your uterus muscles time to relax. Now, in situations where there are indications of fetal distress from the oxytocin due to the increased uterine activity, we can give you a medication called terbutaline, which will relax the muscles of your uterus. It'll stop your contractions and give you and your baby time to recover. Now, as I mentioned, we will monitor you and your baby closely during the whole process to make sure everyone is safe and happy, and so that if any complications do arise, we can deal with them quickly and effectively. So, Cindy, I know this is a huge amount of information to process. So if you have any questions between now and our next appointment, please send me a text or jot them down like you have today, and we can go over anything at the next appointment. Thanks, Cindy, and I'll see you next week, if not before.